Okay, let's switch gears back to MSK, and we're going to go over the biceps tendon top to bottom. And this is kind of a neglected tendon, but there's so much that you can see with the biceps tendon. We're going to start at the shoulder, at the long head of the biceps, and we're going to go over anatomy, function, pathology, variance, and treatment. And this is what we're talking about. This piece of biceps here going from the supraglenoid tubercle down and extra articular there. So where it starts is the superior labrum and the supraglenoid tubercle. And this is an intracapsular extrasynovial structure. There's actually synovium around the biceps while it's in the shoulder joint. And then you can see how it extends laterally through what we call the rotator interval between the supraspinatus and subscapularis muscles and tendons, and then goes in the groove extra-articularly. And notice how, as it's going through, we kind of lose that dark signal in the biceps and the rotator interval. That's the magic angle phenomenon. So we'll keep that in mind when we're talking about things like tendinosis or why we can't see the biceps so well in that location. So there's a supraglenoid attachment. There is the area where we have magic angle called the rotator interval. So the borders of that rotator interval include the capsule. And notice on this diagram the blue structure going from the coracoid to the humerus called the coracohumeral ligament. It goes on top of the biceps and it attaches to the lesser and greater tuberosities of the humerus as well as the supraspinatus and subscapularis tendons. Then underneath yellow, we have a ligament that comes off of the glenoid below where the biceps comes off, the superior glenohumeral ligament. And notice how it's going underneath the red biceps there. That is, again, a part of this whole area that converges in the rotator interval. And of course, you have your supraspinatus muscle and tendon on top and your subscapularis below. And that actually sends fibers over the biceps groove over to the greater tuberosity. So here we have an arthroscopic view of the supraglenoid tubercle, and you can see how the biceps starts up there. And in the sagittal plane here, the red biceps is taking off, and above it is the blue coracohumeral ligament as it goes towards the notch through the rotator interval. And the yellow structure is that superior glenohumeral ligament below. So there you have your supraglenoid tubercle area. And then as we follow it, I like the sagittal images. I start at the origin on the glenoid. Then we see it going through the intra-articular portion, and it looks beautiful in black there. And then it goes to the rotator interval. So remember that you might get some intermediate signal normally in there because there is some magic angle, but in this case, we don't have that here. And what's surrounding the biceps on our image on the right? See these little structures that are linear? That's this coracohumeral ligament on top and the superior glenohumeral ligament on the bottom on the right there. That's called the pulley, and that'll keep your biceps in place. Now, when we're looking in the axial plane, this oblique structure that's going through from the supraglenoid region, then it goes anterolaterally before it goes in the groove. I just wanted to show you how it looks on the axial image there. And remember that its origin on the superior glenoid can be variable. Sometimes a person has it originating in the front of the glenoid, like we see on the left, but some people have it in the back. And so that'll be important, especially if you're looking for a normal variant that we're going to talk about, because most of the normal variant is anterior to the origin of the biceps. And then we get to that pulley area, which has got a green circle here. And again, that's where your biceps starts to go about 30 to 45 degrees into the groove. And notice again, the subscapularis going over that groove to the greater tuberosity from the lesser tuberosity. So you need to stabilize the biceps here because it's going at an angle and it's subject to subluxation and dislocation there. And the pulley does that. So here's a pulley in the sagittal plane. Notice the biceps above the subscapularis and below the supraspinatus in red, your coracohumeral ligament on top, and your superior glenohumeral ligament in yellow on the bottom. And you don't always see the pulley, I have to say that. But sometimes you do, like in this case here. You can see the pulley going underneath the biceps where the arrow is of those two ligaments. And notice the biceps. Notice that little intermediate cleavage in the biceps, that horizontal cleavage. That is a normal finding. I've seen some people call that a tear. If it's not high signal, then that is just part of the biceps. It has this little cleavage in it. And notice how the biceps is higher than the subscapularis tendon where it forms a comma on the lesser tuberosity attachment there. We'll see how when you get problems with the pulley, it actually displaces inferiorly and it gets close to the subscapularis. So this is a normal appearance. And as it starts to go in the groove, we're going to look in the axial plane. And this is an important diagram to show us the biceps in the intertubercular sulcus between the lesser tuberosity medially and the greater tuberosity laterally. And we can see the pulley on top, the blue coracohumeral ligament, the yellow superior glenohumeral ligament on the bottom. And we can see that